country, and I look forward to working with you.
Thank you, Senator.
Thank you, Senator Murray. And Senator Sanders.
Thank you very much, Mr. Chairman, and welcome, Ms. Burwell. Unlike Senator Roberts, I believe in a Medicare for all single-payer system. I think there is something wrong when in our great country we are the only nation in the industrialized world that does not guarantee health care to all of its people, and yet we end up spending far more than most other countries without particularly good health care outcomes. In that regard, in the ACA legislation, I put language in, supported strongly by Senator Harkin, that would give flexibility to states to move in different directions, including a single payer. And as you know, the state of Vermont intends to do that. Right now, we can't do that until 2017. We have applied for a waiver. President supports that waiver. Will you help the state of Vermont work with HSS to make sure that we can facilitate that process and give Vermont the opportunity to lead the nation in that direction?
Senator, if I am confirmed, I look forward to working on that issue with you and the state.
Okay. It's another issue that is dear to my heart, and I know to Senator Harkin's heart. We've worked together on it, and to many people, and that is the crisis in primary health care and the need to go forward with community health centers. One of the reasons that I voted for the Affordable Care Act is that the Majority Leader, Senator Harkin, I, and others worked very, very hard to substantially expand community health centers. And in fact, in the last 4 or 5 years, I think we've added about 4 million more people to gain access through community health centers. In my state, about 1/4 of the people will get their primary health care through community health centers. We are in a difficult problem right now because we're facing a cliff, as you know. And that is, as a result of the ACA funding, we were able to expand community health centers. If that cliff goes into effect, it will be an absolute disaster. And you and I have chatted about this on a number of occasions. You, working with the President, has provided a strong budget for community health centers and for the National Health Service Corps. Mm-hmm. Will you fight to make sure that we continue to strongly fund community health centers throughout America?
Senator, as you and I have had the opportunity to discuss, being from a rural place in the U.S., I actually understand the role of community health centers in communities like the one I grew up in. And so this is something that I believe is an important part of our system. I believe it's an important part in terms of prevention, a topic we've talked about, in terms of treatment as well. And I believe it actually is an important part of efficient and effective health care in terms of cost.
In that investing saves money. But here's my question. Stay with me. We are looking, and in fairness, the President and you have helped make his budget strong. But will you help us fight to make sure that we continue to have that funding and not see that cliff, which would be a disaster for community health centers all over this country? Do I have your support on that?
Senator, you do. The budget that we put together is the first step in that process to do that. Okay.
In a related issue, we're not going to have strong community health centers or strong primary care in this country unless we have the physicians and the nurses and the other staff that we need. To my mind, also in the ACA, and working with Senator Harkin and others, we tripled funding for the National Health Service Corps. And people say, well, that's a whole lot of money. Well, you know what? It's still not enough. Because I think, as you understand, and correct me if I'm wrong, we face a crisis in terms of the number of physicians and other healthcare providers that we have getting out to underserved areas in America. Will you work with some of us, with myself, Senator Harkin, and others, to make sure that we adequately fund the National Health Service Corps to do debt forgiveness or scholarships for medical school students who want to practice in underserved areas?
The issue of primary care in underserved areas is one that throughout the budget you see support for, and whether that's in the issue that you just raised in terms of the National Health Corps, it's also in how we think about not just physicians, but there are also provisions that are about nurses and other people that are part of the primary care system.
No, that's exactly correct.
I think that's another important piece that we need to work on.
What I worry about, and thank you, and I agree with you, we're looking at the expiration of a very important program called the Teaching Health Center Graduate Medical Education Program. and that is a program which allows people to get their doctors to get their training in community health centers, et cetera. Are you familiar with that program?
The graduate medical education program, yes.
Yeah, okay. It may expire. Will you work with me to see that it does not expire?
Want to work to make sure that the graduate medical education program, there are a number of provisions that are attempting to improve and make sure that they focus on what you just articulated, primary care, and where there are shortages in specialties. That's something that's a part of the budget and a series of bringing pieces together that include how we think about the National Health Service Corps as well. And so, yes, that is something that is part of the budget process I've worked on and would look forward to working, if confirmed, in a new role.
Well, thank you very much.
Thank you very much, Senator Sanders. I'm sorry. Senator Scott, have you voted already?
No,
Did you
sir.
vote on the floor?
No, sir.